Live from KSAT 12, the Night Beat starts right now.
Believe it. When you stay home and you don't go out and interact with other people, you are saving lives.
Life-saving advice tonight from an infectious disease doctor as we near another round of shutdowns in San Antonio. Less movement means less chance for spread.
Let's take a look at the latest number of COVID-19 cases in Bexar County. So far, a total of 57 cases. 28 are travel related. 7 were spread through close contact with someone who previously tested positive. 16 are community spread, and the source of exposure for 6 cases still under investigation tonight. The county's first death was reported yesterday. According to city officials, the woman in her 80s, had underlying health conditions.
And at Joint Base San Antonio Lackland, at least 15 personnel have tested positive so far. That does not include the evacuees that were taken to that base. Stay home, save lives. That's the emergency declaration by Bexar County and San Antonio leaders as they announce a stay home, work safe order.
It's an effort to help contain COVID-19, which is already spreading in our community. First responders, medical personnel, and essential businesses are exempt. The Night Team's Patty Santos tells us who this order specifically impacts.
This is not complicated, people. Stay home, save lives.
The city of San Antonio and Bexar County are ordering residents to hunker down as COVID-19 spreads in our community. Non-essential businesses will be forced to shut down starting Tuesday at midnight until April 9th. Exemptions are made for some, including healthcare workers, first responders, those in government functions, education personnel, financial institutions, child care services, hotels, and home maintenance type services like plumbers and electricians.
We're telling people that you must go home. Unless you're engaged in an essential activity, you must go home. It doesn't matter what time of day it is.
Judge Nelson Wolf says it's a preventative effort to help our hospitals handle the peak that's coming. In our Region 8, which includes 28 counties, he explains there are some 3,700 hospital beds. About 800 of those are isolated beds, and there are only 400 to 500 ventilators available.
That will help us if we keep this flat. But if we don't keep it flat and we don't take preventive measures, then it's going to spike up and they're not going to be able to handle it.
Residents say the full stay-at-home order will change things.
Families are just trying to take care of themselves.
Officials say most area residents and businesses have complied with the orders given so far. Others question the need for such restrictions.
Really, this is all too much of a hype.
There probably is a percentage of people that may not or won't choose not to comply or try not to comply, I'm sure, but if they tell us to stay at home or tell me to stay at home, I guess I've got to stay at home.
If somebody's going from one place to another, they should be going home unless they're going to an essential service.
And again, grocery stores, gas stations, and pharmacies, they're all still open. Outdoor activities are limited, but also still allowed. If you want to read the specifics on this order, head to KSAT.com. Patty Santos, KSAT 12 News.
Is it hype? Why is it so important that people stay home? Well, that decision was one the mayor and county judge said they decided on with input from the medical community, and they gave business leaders the heads up on their emergency declaration. The stay-at-home idea mirrors decisions made in other communities across Texas and the country. Dr. Ruth Bergeron is an infectious disease doctor at UT Health San Antonio's Long School of Medicine. She applauds the mayor and county judge's decision.
I know this is dire. It's difficult for everybody. These are extraordinary times. We've never lived through times like these. But if we do nothing, we know for sure we're going to have rapid community spread and overwhelming our hospital system. So believe it, when you stay home and you don't go out and interact with other people, you are saving lives.
We talked to Dr. Bergeron during the KSAT News at 9. She is asking people to be kind to one another as well. She says there are a lot of things with this virus that people can't control, but our attitudes towards each other is something we can. She's been advising the county on steps to take to battle the coronavirus locally. And you heard her say she's especially worried about the county's healthcare system being overrun if the number of cases continues to grow.
That's one of the reasons she and other doctors are asking for the community's support. Tomorrow and Wednesday, UT Health San Antonio is asking for your help collecting as much protective gear as possible to be given to their healthcare providers. Most needed are face masks, including N95 respirators, surgical masks, and masks used by painters, carpenters, or hobbyists. They're also accepting unused medical or disposable gloves, eye protection goggles, face shields, and thermometers. You can drop off items from 7 a.m. until 6 p.m. at UT Health San Antonio. You're asked to head to the entry station near the intersection of Floyd Curl and Medical Drive, and you'll be directed from there.
Running at maximum capacity. That's how Assistant City Manager Dr. Colleen Bridger describes her staff's response to COVID-19. Officials have still not released the name or exact age of an area woman who died over the weekend from complications of COVID-19. Dr. Bridger says public awareness about COVID-19 is prioritized over releasing specific information about the victims. Bridger said her current priorities are to stop the spread of COVID-19, make sure the healthcare system remains stable, and keeping everyone briefed on the latest information. A testing task force is now meeting every other day, and private labs have been briefed on how to report both negative and positive results back to Metro Health. Eventually, the city plans to map out the hot spots where people tested positive in Bexar County.
The coronavirus also impacting the way veterans are buried and honored. All Department of Veterans Affairs national cemeteries will adjust operations in response to COVID-19. At Fort Sam Houston National Cemetery, new guidelines were implemented today. Tiffany Huertas reports that includes suspending funeral honors and large gatherings.
She was married to my father, who was in the Army.
Rebecca Redding came to visit her mother Monday afternoon at Fort Sam Houston National Cemetery. Rebecca says she can't believe the changes the cemetery has put in place.
If this was going on, my dad passed away, God forbid, tomorrow, I would be very upset not having him honored in the way that he would want to be honored.
Funeral homes will come out, and then we'll take over custody of the remains, and then we complete the interment process.
This will be the only way those who served our country will be laid to rest at Fort Sam Houston National Cemetery until further notice.
We're currently not holding committal services at our shelters for family members to attend.
As part of federal efforts to limit the spread of coronavirus, large committal services and military burial honors will come to a stop at veteran cemeteries.
Currently, our volunteer honor guard, they are VA volunteers, and they currently are not rendering honors because we're not having any committal services at our shelters. We're doing this to protect not only the funeral homes and the families, but our volunteers and our staff as well.
The cemetery will remain open for visitations. The director of Fort Sam Houston National Cemetery says they're following guidelines from the CDC.
And so even though we're open and for visitation, and the community is more than welcome to come out and visit their loved ones' grave sites, we just want them to stay safe and minimize the travel if they can.
Cemetery Director Aubrey David says even if families choose to have a person buried right now, they can schedule a full service at a later date.
I think for our national cemeteries, it's our job to provide dignified, respectful burials for our veterans, and I'm just glad that we're able to remain open and continue to provide those services.
Tiffany Huertas, KSAT 12 News.
Now, families may request to view the burial, but they will be kept at a safe distance with no more than 10 immediate family members. As Tiffany mentioned, the U.S. Department of Veteran Affairs says families can postpone a currently scheduled burial to a later date.
They are on the front lines when it comes to confronting COVID-19. Doctors and nurses helping patients with the virus and in other emergencies. Governor Greg Abbott is putting certain nursing students on a fast track to jump in and help as the needs grow. The Night Team's Jaffney Gray spoke with one nursing student who wants to help her community.
I think that our community needs all hands on deck, and I'm ready. I'm ready for the call for it.
San Antonio College nursing student Jasmine McGill says she's fired up to serve after Governor Greg Abbott's recent announcement to waive regulations to address the potential shortage of nurses because of the coronavirus pandemic.
This will allow temporary permit extensions to practice for graduate nurses and graduate vocational nurses who have yet to take the nursing licensing exam.
McGill says these types of nurses will potentially be handling basic activities to care for the patient, but she says it will help out tremendously.
We would be doing things like toileting, ambulating our patients. We can measure INO. We can do a lot of these critical tasks that help take a lot of time away from the healthcare workers that are experienced and seasoned and the veterans that are on the floor.
McGill has been busy completing her clinicals at home through an e-learning online experience because of the coronavirus.
The hospitals had to kick us out as students because we're another large body that could be a possible exposure to the patients.
Governor Abbott also announced retired nurses will also be able to reactivate their licenses to help.
I think it's kind of cool. That's like asking Rocky Balboa to come back to the game. You know, they're veterans, they're seasoned, and they're the most knowledgeable. And a lot of these nurses have been around through other smaller pandemics.
McGill says she doesn't know when exactly she or her fellow nursing students will be called for action, but she is positive about the future.
We're going to come out on top of this, and we're going to be around to say, you know what, I helped save those lives.
Japhanie Gray, KSAT 12 News.
Well, major decision tonight. No abortions will be performed in Texas unless the mother's life is in danger. Officials say it's being done in an effort to preserve medical resources for COVID-19 patients. Texas Attorney General Ken Paxton made the announcement today, one day after Governor Greg Abbott ordered healthcare facilities to postpone procedures deemed not medically necessary. CEOs from the 3 Planned Parenthood facilities in Texas say they're reviewing the governor's executive order regarding hospital capacity. A joint statement reads in part, quote, "The priority of all Planned Parenthood health centers in Texas is the health and safety of our patients and staff and ensuring that Texans can access essential health care, including abortion," end quote.
The coronavirus delaying a decision on the city's request to move the cenotaph that sits near the Alamo. The Texas Historical Commission set to hold a meeting tomorrow and another on Wednesday to discuss the matter. That's been pushed back. That quarterly meeting has now been postponed until further notice, as a matter of fact. The commission asked the city to give more information on the project, including more explanation on why it should be moved and a list of any potential alternate sites where that monument could be placed.